Hello, this is your YouTube and screencast for cancer and hereditary disease. Again, I am Alice Shapiro, your instructor for HIT 154 this term. Obviously, in the 15 minutes I have, we're not going to cover everything about cancer, nor are we in this class. It would take more than our whole lifetimes. So we'll just cover some of the basics. The main objectives for our study of cancer and hereditary disease is to do what is described here on this page. You can read this yourselves. And I may break this down into one about cancer and one about hereditary disease. We'll see what kind of time we have. More of the main objectives, notice they are here for you. And I will be presenting some specific diseases. You will see those on your Moodle page and in films and articles I've included for your information. All right, cancer is the leading cause of death worldwide and afflicts 2 of every 3 families, so almost 67% of families are affected by this disease. They will continue, and they are projected to continue. And in the United States, half of all men and at least 33% of all women will be diagnosed with invasive cancer in their lifetime. These are mind-boggling statistics, really. Here's the definition of a neoplasia. Neo means new, plasia means growth, and this describes both benign and malignant. Make sure you know these basic definitions. Here are some classifications of tumors, whether there are nodes, whether it has spread, whether there's metastases. And some of this classification may be changing and updated, but these are the important terminologies on how to classify as they exist right now. And of course, these data are in your textbook as well. Here's some nomenclature, the different types of cancers that occur and where they occur, if it is in your epithelial or layering and lining tissue, such as skin and lining of our digestive, respiratory, and other tracts, reproductive. It will be cancer of the epithelial cells, and here are the classifications. If it is within connective tissue, there is a different classification. All right, here are some benign. Benign literally means kind. So these are non-cancerous tumors. They can be dangerous. They can be life-threatening in some cases, depending upon where they are located and what vital organs they interfere with. All right, here are some normal cell regulation mechanisms. Regulators will inhibit growth, will involve growth factors. We don't want our cells to grow without control. We want our liver cells, for example, to stop growing and producing liver cells when they come into contact with pancreas cells and so forth. Chemicals called cyclins, which are important in the life cycle of the cell, and apoptosis, which is normal cell death. Cells do die, and if cells continue to live beyond their lifespan and do not have apoptosis, or if a disease cell cannot be recognized by our immune system and eliminated, then this is also a problem for cancer. Here's the progression of cancer. There is some initiation and promotion. We may have cancer cells in our body, or potentially cancerous cells, and unless they are promoted, perhaps genetic factors, perhaps environmental factors, they will not cause us harm. All right, so here are again some terminologies really. Carcinogenesis means the giving rise to cancer. Mutation is a change in our genetic information which can become cancerous. An onco refers to cancer, so an oncologist is a person who studies cancer. Oncology is the study of cancer, and an oncogene is a gene which codes for cancer. We also have within our immune system tumor suppressor genes and genes that can repair our genetic information. Here is some vocabulary regarding the classification of cancer. Please understand what these mean. And some of those were on the chart which I just showed you. There are some mixed cancers which can involve both epithelial and connective tissues, and so on. This is what leukemia might look like, a change in our white blood cells. All right, here's some general cancer warning signs from the American Cancer Society. And you can read this again. If you have a sore that doesn't heal, nagging cough or hoarseness, change in a wart or mole, and so forth, or someone you know, or a patient or a loved one, this is worth checking. This is worth having a medical practitioner take a look. Lung cancer, again, I'm not going to read this for you. Lung cancer is a very devastating cancer. Air pollution can cause cancer, is certainly a risk factor, but the more than 90%, so the greatest risk factor for lung cancer is tobacco smoke, whether it's from the smoker, her or himself, or secondhand smoke. So if you live with a smoker, then that is a tremendous risk for you. Or if you are a smoker and you have children or loved ones living with you, that is a tremendous risk for them. All right, most lung cancers are clinically silent, cannot be detected until they are quite far progressed. Here are the major types. Again, take a look at that. Screening diagnosis begins with patient history and so forth. Sputum can be analyzed, blood tests, and this tells you some of the treatments that can be done. And sometimes multiple chemotherapy agents are a better treatment than just one single chemotherapy agent. But again, the best way for preventing lung cancer is to reduce risk factors, to stop smoking if you can, to move from a highly air polluted place. Breast cancer is the most frequently diagnosed cancer in women. And just to share with you, I myself am a breast cancer survivor from November of 1991. So it's been a lot of years and I'm still here. Anyway, all right, the earliest sign of breast cancer is often an abnormality detected on a mammogram or breast self-examination. Just for your information, my small tumor did not show up on a mammogram. So if you feel something in your tissue that is abnormal, it is worth having it checked out. Or if you have some of the less common symptoms, please, for any type of disease, don't ignore symptoms. Right now, unfortunately, since we don't have totally effective therapies in all cases or in many cases, and we do have risk factors in our environment, one of the best solutions, let's say, for a longer survival time and rate is early detection and therefore treatment if necessary. All right, this tells you some more information about breast cancer. There are some environmental factors. This tells you some of the surgeries. Again, please read this and understand. I'm emphasizing the information that I'm showing you in the PowerPoints because we can't study everything. Here's a diagram of what testicular cancer may look like. And this tells you something about testicular cancer, who is at risk. If an individual has a history of undescended testicles, that is a risk. It's often a painless lump. Again, do not ignore any signs or symptoms. Okay, lymphomas, Hodgkin's disease or non-Hodgkin's lymphoma. This tells you a little bit about the differences between Hodgkin's disease and non-Hodgkin's lymphoma. Lymphomas, of course, are cancers of the lymph tissue. And this tells you some of the risk factors. If you have swelling of the lymph nodes, it could indicate a number of anomalies. Again, make sure you and or your patients have this checked out. All right, here's more of how to diagnose. Leukemia is a cancer of the white blood cells with an abnormally large number of abnormal leukocytes, which are white blood cells. And organs where blood is stored, such as the liver and spleen, become greatly enlarged because they're infiltrated with these large, malignant, highly, quickly reproducing white blood cells. The cause is unknown. Again, it could be radiation, it could be a virus. Nuclear energy. People who survived Hiroshima and Nagasaki have very high rates of leukemia. Signs and symptoms, again, swollen lymph nodes, anemia because there's an overabundance of white blood cells and therefore an underabundance, we could say, of red blood cells. These are the types of leukemia. If it originates in the bone marrow, it is myeloid. Bone marrow is, myelin is the medical term, the root word for bone marrow, or it could exist in the lymphatic cells. And here are some more types of leukemia. Treatments, side effects. There are always side effects to harsh treatments such as chemotherapy. Pancreatic cancer is extremely deadly. Again, smoking is attributed to a large number, 30% of the cases. Also diets, low in fiber, high in fat, high in red meat. Alcohol also has been attributed to a risk factor for pancreatic cancer. The survival is poor. All right, cancers of the nervous system. The first peak is in childhood when brain cells are developing and proliferating. The second peak is in older adults. Please read about this. I'm going rather quickly, but you do have these slides available to look at, both narrated and unnarrated. All right, so screening is recommended. There are tumor markers. We can do scans or MRIs, biopsies, endoscopy, which is examining the interior, particularly done for cancers of the GI tract, including colonoscopies. We looked earlier at the different stages of cancer and how staging is done. Stages 1, 2, 3, and 4. 1 usually means it's contained and hasn't spread. 2 may be spreading to the lymph nodes. 3 may be to other organs. And stage 4 is to multiple organs. All right, prevention. Reduce your risk factors. Get screened. And so forth. All right, here's recommendation for asymptomatic. Discuss these with your doctor, or if you become a medical practitioner in contact with patients, discuss these various screening tests that are available. All right, we're going to end this now because I'm almost out of the 15 minutes I have, and I will be doing another screencast narration for the hereditary disease portion of the unit we are now studying. Make sure you ask me any questions early on, and again, I'm emphasizing the information on the slide since we can't possibly learn or know everything that's in the book or everything there is to know. So I wish you a pleasant time studying, and I will be chatting with you soon.